So here is the scenario of the man that is 30-year-old. A 30-year-old man presents with the right upper quadrant pain, and he has been well except for an episode of diarrhea that occurred 4 months ago just after he returned from a missionary trip to Mexico. He has lost 7 pounds weight and he is not having diarrhea. On examination, his BP is 140 by 70 and heart rate is 80 and temperature is 37.5, 99.5 degree Fahrenheit. And on examination, abdomen has right upper quadrant tenderness without rebound tenderness, and there is some radiation of the pain to the shoulder. The liver is percussed at 14 centimeter. There is no lower quadrant tenderness and bowel sounds are normal and active. Which of the following is the most appropriate next step in the evaluation of this patient? Option A, serology and right upper quadrant ultrasound. Option B, stool for ova and parasite. Option C, blood cultures. And option D, diagnostic aspirate. And option E, empiric broad spectrum antibiotic therapy. So what will be the answer? Answer is A, that is serology and upper quadrant ultrasound. The history and examination in this case suggests the amebic liver abscess, and symptoms occur usually into 2 to 5 months after travel to an endemic area. Diarrhea usually occurs first but resolves before the hepatic symptoms develop. The most common presentation for an amebic liver abscess is abdominal pain, usually in the right upper quadrant. So this is the scenario of the amebic liver abscess. And amebic serology using the enzyme immunoassay is a sensitive test and is positive in 90% of the patients. Ultrasound has 75 to 85% sensitivity and shows abscess with well-defined margins. Stools will not show the trophocyte at this stage of the disease process, and blood cultures and broad-spectrum antibiotics would be ordered in cases of pyogenic liver abscess. But this patient's travel history, the chronicity of his illness and his lack of clinical toxicity suggest Entamoeba histolytica as the probable cause. Aspiration is not necessary unless the rupture of the abscess is imminent, and metronidazole remains a drug of choice in the case of amebic liver abscess. So remember, metronidazole, drug of choice.